Alright, go ahead.
You're arriving at the scene of an unconscious female laying on the ground.
I am now on scene and my PPE is on. Is my scene safe?
Scene is safe.
Is this my only patient?
That's your only patient.
Okay. Looks like my mechanism of injury is an unconscious young woman. I'm going to go ahead and request an LAS unit and have my EMT partner stabilize her C-spine. My general impression is I have a young woman found face up and unconscious with a ladder nearby. I suspect of a possible fall. Gonna go ahead and advance to check her APU level. Hello, ma'am. Can you hear me? Gonna go ahead and advance to pain. Ma'am, can you hear me? Are you okay? Looks like my patient is still unconscious. Is there any apparent life threats?
No apparent life threats.
Okay, so my chief complaint is still an unconscious patient. Now, I'm going to go ahead and advance to my ABCs, starting off with airway. Is her airway clear?
Airway is patent.
Okay, going to go ahead and check for lung sounds. How are my lung sounds?
Lung sounds are short and shallow.
Okay, I'm going to go ahead and provide O2 therapy through a non-rebreather mask at 15 liters per minute. And then I'm going to check her circulation. How is my pulse?
Pulse is weak and thready.
And her skin conditions?
Her skin conditions are cool and diaphoretic.
Okay, is there any major bleeding?
No major bleeding.
Okay, I'm going to also go ahead and provide my patient a blanket for shock management. She's already on her back. My patient will be a priority patient and I'm going to prepare for transport. Now I'm going to advance to my secondary assessment and check her for decap BTOS, starting off with her head. Checking the back of the skull, forehead, eyes, nose. Are my eyes clear?
Eyes are clear.
Okay, advancing to the nose. How's my nose?
There's slight bleeding out of the nose.
Okay, I'll take note of the bleeding. Checking down to the jaw and the mouth. How's my mouth?
Mouth is clear.
Okay, and before I advance, I'll check the ears. How are the ears?
Ears are clear.
Okay, gonna go ahead and check the trachea. Is my trachea straight?
Trachea is straight.
And do we have any jugular vein distension?
No jugular vein distension.
Okay, I'm gonna continue and check the shoulders for decap BTOS, clavicle, chest, sternum. Go ahead and advance to the ribs. Now I'm gonna palpate the abdominal wall, the 4 quadrants. There's 1, 2, 3, 4. Now I'm at the pelvis, checking for decap BTOS. Seems good. Checking the hips. Now I'm gonna take a peek at the genitalia, make sure there's no bleeding or discharge. Is there anything?
No.
Okay, I'll go ahead and continue down to the left leg, the lower extremity, checking for decap BTOS, checking the patella, lower leg, down to her foot, checking for pedal pulse, capillary refill, and motor sensory by providing a Bavinsky. I'm gonna go ahead and continue on to her right leg, checking for decap BTOS, checking the patella, checking the lower leg, down to the foot, pedal pulse, capillary refill, and a Bavinsky check again. Gonna come back up and check the upper extremity, starting with the left arm for decap BTOS, checking the capillary refill. Gonna go ahead and advance to the right side, palpate for any decap BTOS, down to the hands, capillary refill. Now with the help of my EMT that's holding C-spine, on their count, I'm going to roll her over onto her back whenever my partner is ready.
1, 2, 3.
Go ahead and check in the spine, starting with the cervical, down to the thoracic and the lumbar. Is my spine straight?
Spine is straight.
Okay. Checking the rectum for any bleeding or discharge. Is there anything?
No, nothing.
Okay, and then lastly, I'll check the back of the legs for decap BTOS. Now on the count of 3, we'll roll them back.
1, 2, 3.
Okay. Since my patient is a priority patient, I'll reassess them every 5 to 10 minutes. And after my secondary assessment, I will manage any secondary injuries or wounds.